This is the story of Helen Tucker, her journey through the medical community to seek treatment for her diabetes, and how electronic health information exchange played an important role in her journey. Helen has been a diabetic patient for some time, and unfortunately, she does not manage her disease very well. Dr. Brown is Helen's primary care physician, but for our purpose today, let's shorten that and call Dr. Brown her PCP. When Helen has a medical issue and Dr. Brown can't see her or his office is closed, she sometimes visits an urgent care clinic or the emergency room. As we begin our story, Helen's foot has been hurting for a few days, and on Saturday she notices a sore on her foot that she thinks might be infected. Since her PCP is closed on weekends, Helen goes to a nearby urgent care clinic. This is the first time Helen has visited this particular clinic, so she completes all the paperwork at the registration desk and gives them her insurance information. After waiting for a few minutes, a nurse asks Helen to come with her to an examination room. Soon, Dr. Smith comes into the exam room to check out Helen's foot. Helen is very surprised to find out that Dr. Smith already has information about the other doctor visits Helen has had recently. Dr. Smith explains that because the clinic is connected to the local Health Information Exchange, or HIE, he is able to access information from Helen's other doctors and can see her allergies, medications, and recent test results, among other things. One of the things Dr. Smith noticed in looking at Helen's medical history was that she was overdue for her regular A1C diabetes test. So he told her that they could go ahead and do that today, then make the results available to Dr. Brown, her PCP, through the Health Information Exchange. Helen liked that idea because she had received a call from Dr. Brown's office just a few days ago asking her to make an appointment for the test. Dr. Smith treats Helen's foot, orders the test, and recommends that Helen schedule a follow-up visit with her regular physician because the sore on her foot is a complication from her diabetes. After Helen leaves, Dr. Smith finishes his notes about her visit and has his nurse send all the information to the Health Information Exchange through their Electronic Medical Records, or EMR, system, which makes it available to Helen's primary doctor for her follow-up visit later on. The following week, Helen schedules an appointment with Dr. Brown, her PCP, as recommended. When she arrives at Dr. Brown's office, she is happy to learn that he already knows about her foot sore, how it was treated at the urgent care clinic, and that he has the results of the test that they did. Dr. Brown has all of this information because he is also connected to the local HIE. Dr. Brown checks Helen's foot and thinks that it is healing very well. He also discusses the diabetes test results with her and talks about how to keep her diabetes under better control. Helen goes home thinking that she needs to do a better job of following Dr. Brown's advice so she won't have these types of problems. When Dr. Brown finishes his notes about Helen's visit, his nurse also sends them to the HIE, just like the urgent care clinic did. Late in the evening, a couple of days later, Helen notices she's having a hard time breathing, and she thinks she might have a fever. This worries her, so she decides to go to the local hospital emergency room since Dr. Brown's office is closed. When she arrives at the emergency room and is checking in at the registration desk, Helen feels very lucky that the hospital is also connected to the Health Information Exchange because her information is available in their system and she doesn't have to fill out a lot of paperwork. She thinks this is great because she isn't feeling well at all, and the last thing she wants to do is answer a lot of questions. The emergency room doctor is able to review Helen's medical information from the HIE to see her diabetes diagnosis, recent office visits, her allergies, and medications. When the doctor listens to Helen's chest, he hears fluid in her lungs and decides she needs to be admitted to the hospital. The doctors at the hospital determine that one of the medications she was given for the sore on her foot created the fluid in Helen's lungs, and that she also has a serious kidney infection. After a few days of treatment, Helen is much better and is discharged by the hospital with instructions to follow up with her PCP. When Helen is discharged, Dr. Brown is automatically notified by the Health Information Exchange, so his office can schedule her post-discharge follow-up appointment. The hospital physician recommends, and Dr. Brown concurs, that Helen see the kidney specialist who consulted on her case while she was in the hospital. Dr. Brown's office sends a referral request to the specialist, including Helen's summary record containing her patient care information, using the secure messaging service built into the HIE. Helen's hospital record and discharge information is sent to the Health Information Exchange from the hospital, making it available to other participating physicians in the community. After returning home, Helen is contacted by the kidney specialist's office to confirm her appointment. When she arrives for the appointment, Helen is amazed to find that this doctor already has information on her current conditions, including medications and allergies. She is asked to review and confirm the information, which she finds much better than having to fill out more repetitive paperwork. The specialist, being a member of the community HIE, was authorized to access Helen's medical data, including her recent hospital stay information and test results, as well as information about her diabetic condition. As a result, the specialist is better able to evaluate Helen's final test results from the hospital and talks with her about things she should do to keep her kidneys healthy. After Helen's appointment is over, the specialist's EMR system is used to send the information to the HIE, making it available to physicians who will be treating Helen in the future, should they want or need the information. The kidney specialist also uses the HIE's secure messaging to send his notes regarding Helen to Dr. Brown and thanks him for the referral. Now, the next time Helen visits Dr. Brown, he will have access to all of the information from her hospital stay and her new kidney specialist through the HIE. Helen realizes there is a common thread in her recent medical issues. All of her doctors are telling her how important it is that she manages her diabetes better than she has been. To help her do this, she has been given access to the local HIE Community Patient Portal by her primary care physician, who assigned Helen her own Patient Health Record, or PHR. Even though she isn't very comfortable using a computer, she decides to give it a try, because she really does want to start feeling better. Through the patient portal, in her PHR, Helen finds educational information about managing her diabetes, as well as her doctor's summaries and the discharge instructions from her recent office and hospital visits. Reading their summaries and recommendations, Helen realizes that she must start doing what her doctors tell her to do. She certainly doesn't want to go through her recent experiences again. Helen thinks the patient portal and her PHR are easy to use, and she likes the information, tools, and education she finds there. So she starts using it to track her daily glucose readings, the vitamins and medications she takes, and her new exercise routine, walking around her neighborhood. She is also following the nutrition advice she found in the education section of the portal and starts tracking the food she eats in her patient health record as well. All of this information will now be available to Helen's doctors during her future visits, should they need it. The doctors can view her progress and continue to make the best recommendations possible. When she finds that she can also communicate with her doctors through the portal, she sends a request to Dr. Brown, her PCP, asking for an appointment sometime in the coming weeks, as recommended by her kidney specialist. The appointment is scheduled, and to Helen's surprise, 2 days before her appointment with Dr. Brown, she receives a message from his office through the patient portal reminding her of the appointment. She had also set up a 1-day advance reminder for herself in the patient portal, and she receives that notice the following day. What a great convenience, Helen thinks, to help her remember when she has a doctor appointment. And once again, when she arrives at Dr. Brown's office, he already has the information about what has been happening with Helen since her last visit. He can see that her glucose readings are getting lower and becoming more stable, and she is increasing the length of time that she walks a little bit every day. He tells Helen she is doing very well and how pleased he is that she is taking better care of herself and using the patient portal and her PHR to manage her condition. If she keeps up the good work and continues to improve, there might come a time when she could stop taking some of her current medications. Helen is thrilled with this idea and leaves Dr. Brown's office with a renewed determination to take care of herself. So, we're coming to the end of this chapter in Helen's journey through her medical community. Helen is very pleased with the care she has received in the last few weeks. Because each of her doctors have been so well informed during her recent health problems, she feels like they all truly care about what she has been going through. Each one mentioned her other doctors and what they had noted in her medical information. All of them are offering advice about how she can take better care of herself, and each time she finds that the advice seems to be coordinated with what her other doctors are telling her. And maybe most important of all, Helen is doing her part by using her PHR through the patient portal to more closely follow her doctor's advice. She's exercising and eating healthy foods and has noticed that she has more energy. Helen decides that she is going to continue her new and healthy ways because she's feeling healthier and happier than she has in a long time.